It's 9 o'clock, ladies and gentlemen. All legal notices have been posted. A quorum of the court is present, and so this meeting is duly called. Can I get a motion to close the court for the January term? Got a motion by Dr. Garcia.
Second.
Second by Commissioner Cox that we close the January term. Is there any unreadiness? All those in favor, let it be known by your sound of voting.
Aye.
Those who oppose, same time. Chairs in the affirmative. Need a motion to open the court for the February term.
So moved. Second.
Got a motion from Commissioner Daniels, second from Commissioner Garcia that we open the February term. Any unreadiness? All those in favor, let it be known by usual sound of voting.
Aye.
Those who oppose, same sign. Chair in the affirmative. Bailiff, will you please open the court?
All rise. The Dallas County Commissioners Court is now in session for the February 2022 term. The Honorable Commissioner John Wiley Price presiding. Please remain standing for the invocation.
Today, the invocation will be given by a guest of Commissioner Elbar Garcia.
Thank you, Commissioner Price, Chair. I have an honor to introduce today a good friend of mine for many, many years. I don't even want to say how many, but he is one of our members of the Oak Cliff Lion Club. He has served in many capacities in our club, and is also the manager of communications and outreach with Envision Dallas. Totally blind since infancy, Mr. Lindsay offers a unique perspective on all aspects of Envision Dallas employment, education, and programs. He is well-known voice talent of Dallas-Fort Worth radio stations such as Kiss FM and KLUB, and manages his own production company, Blazing Blake Productions. In his free time, he produces nationwide radio and TV commercials and specialized audio branding for businesses. He has also authored 2 books, Out of Sight Living, a sightless person with pure vision, as well as Blind for a Purpose, turning life challenges into purpose in life. Prior to joining Envision Dallas, Mr. Lindsay worked with Ziegler Corporation, the Dallas Area Rapid Transit, and Bank of America. He attended Brookhaven Community College in Farmers Branch in North Dallas. Thank you, Blake, for being here with us this morning for this invocation for the Dallas County Commissioners Court. Thank you.
Thank you, Commissioner Garcia. Wow, they got a good microphone here. Good morning, buenos dias, everybody. My name is Blake, and what an honor it is to get to be with you live today. I feel real good about that. You know, cancer took my sight when I was an infant, went totally blind, but it didn't take my life. And every day I get up and I'm so thankful for another great day to be alive. And I never know who I'm going to meet, you know, and it's just such an honor to be in the Dallas County Commissioners Court. I know a couple of you, and just a real honor today. Let's pray, everybody. Dear God, our Heavenly Father, I want to thank you for another great day to be alive. We got a lot of decision makers in this room today, and we just pray for your anointment on their lives and their decisions that they make today and every day. We just thank you that Dallas is a great place to live, Dallas County, and I'm just real pleased to be able to work here, and what an honor it is for me to get to make new friends here today. I just pray that we'll get to meet again, and I thank you for this honor, and just pray for decisions and for the city. Help everybody to be positive. We know that we've got a negative world that we live in occasionally, but we have the ability and the capability to turn that around. And we thank you for that. In your name we pray and give you all the thanks. Amen.
Amen.
Everybody make it a great day, and just enjoy making it a great day for everybody you're in contact with. Thank you for having me.
Thank you, Mr.
Thank
Lindsay.
you.
Thank you.
Blake.
Appreciate it.
See you soon.
Well, we have a posted agenda, but first of all, I'm going to ask the court to suspend the agenda. We'll continue up to a point, but can I get a motion to suspend the agenda?
So move. Second?
Okay, got a motion. Well, no, we're going to do the resolution and all, but there's a presentation and they're not here yet. I'm just putting it in proper. Got a motion by Dr. Garcia, got a second by Dr. Daniel that we suspend the agenda. Any unreadiness? All those in favor, let it be known by use of sound of voting. Aye. Those who oppose, same sign. Okay, H is resolutions. I happen to have the first resolution, and I'm going to ask Ms. Linda Mason and her delegation to kind of come forward. There were a number of people that sent me emails, Ms. Mason, with regards to the fact that they couldn't be here today. In fact, one says she's picking a jury, and I wouldn't dare reroute her. But anyway, jury and is unable to attend, but she just wants to know how much she appreciates you, the admiration, your professionalism, your diligence, and that over the last 5 years, she's gotten to know you, and she wishes you the best, and apologies for not being able to attend. That's Judge Nancy Kennedy. And whereas Dallas County has a solid record of committed and dedicated employees who are charged with the health, welfare, and safety of our county's expansive and diverse populace. And whereas Linda C. Mason is a native Texan born in Jacksonville in Cherokee County, graduated from Lincoln High in Dallas, and furthered her education at El Centro, Cedar Valley, and North Lake Community College campuses. And whereas Linda C. Mason began her first round with Dallas County in 2010 as a senior secretary in the misdemeanor courts, left the county and returned in 2012 to the position of senior secretary in the Environmental Health Department of Health and Human Services, transferring as an administrative assistant to the felony court manager in 2016, serving in that same capacity until now. And whereas Linda C. Mason is active in her community, is a proud member of the National Council of Negro Women, Suburban Dallas DeSoto section, and spends most of her free time baking and traveling. And whereas Linda C. Mason draws on the support of her loving family, which includes daughters Dana and Charla, 6 grandchildren, and 4 great-grandchildren, all of whom she loves dearly. Therefore, be it resolved that the Dallas County Commissioners Court now congratulates Linda C. Mason as she announces her retirement and looks forward to a new phase in her life with a great sense of joy and anticipation, and I so move.
And I second.
Got a motion and a second. Any unreadiness? All those in favor, let it be known by usual sign of voting.
Aye.
Those who oppose, same sign. Chairs in the affirmative. Ms. Mason,
Yes, sir.
the microphone is yours.
I just want to thank the commissioners and Dallas County, and also to the pleasure of having to work with you all and to be of service to you. I most of all am grateful for knowing you, Commissioner Price, and working with you and for you. Thank you all again.
You want to introduce those folks in your delegation?
Yes, this is William Askew, the love of my life, and this is Nikish Greer, Indigent Defense. This is my replacement. This is Denise Alvarez. And this is my boss, Keita Dickerson.
Okay. Well, good. You know, the only thing, you know, you got a chance to escape from Dallas County and you returned.
Yes.
And I don't know what that says about you. You know, I worked with you when you were in the misdemeanor courts. So I watched you at HHS, and everywhere you've been, you've excelled. And just thank you for that kind of commitment. I think we've probably known each other for at least the last 35, at least, maybe plus years. Yeah, right. So, but we're just glad that you spent some time here with us. Okay. And we wish you well.
I just wanted to say that there is no way that we can do what we need to do without so many, many, many people doing everything that they can do to the best of their ability. Would also like to note that we need you, and occasionally you need us. So
Yes.
working together is the way to do it, but just thank you so much for what you have done. I don't think that, we've seen each other, but we really haven't interacted a lot.
Right.
But, we do know that it takes real-life people to do real-life things in order for Dallas County to be all that it can be. So thank you very much.
Thank you.
Ms. Mason, congratulations. Thank you for your service to Dallas County and their citizens. And of course, it's always amazing to me that when people retire after serving so many years, it's always, I want to travel and do all the things I haven't done in a long time. So enjoy it. Keep in touch, send us those pictures.
Okay.
Since Commissioner Price is still here,
Okay.
he might want to go and travel with you one of these days.
Yeah,
All right. And as of today, it's my 10 years.
okay.
Thank you, Ms.
Thanks
Mason.
again.
Next, I guess we'll go to, is Dr. Wong on the call? Because I still don't see I see Doug, but I don't see the other. Kim, okay, you just walked in. This was part of, well, let me get with Dr. Wong. Dr. Wong, are you there?
Yes.
Okay.
He's going to do the resolution form. He's going to take a while. Are you going to do the resolution form? For them, please?
Oh, that's Clay. I don't want to presume he wants me to do it.
Okay, sounds good. Let's go.
Yeah, I don't want to know if he wants to presume.
Sounds good.
Okay, Dr. Wong.
Okay. All right. If we could move to the next slide. We do remain in the red high transmission risk level for Dallas County. Next slide. As you can see, available ICU beds still on the low end. And it's not all due to COVID, but due to other conditions also. But again, it shows the certainly continuing stress on the healthcare system. Next slide. These are the suspected and confirmed emergency department visits in the prior 24 hours. And you can see the good news is that over the last 2 weeks, we are seeing this decline in the ER visits. And so that's the early indicators that we've seen also in the past. So it does look like we've reached the peak on the number of new cases. But I will also note that if you look at the absolute level of where we are, we're still at a very high level of emergency department visits, almost, getting almost as high as some of the peaks we received earlier with Delta. So again, it's good news that it's declining, and it's declining pretty rapidly, but we still are at relatively high levels. So it is not an indication that we are out of the woods and everyone just go back to normal. Next slide, please.
Dr. Wong, just on this slide, just kind of for our future planning as we start to look into the late spring, when looking at these suspected ER visits, where is a sustainable level? Because clearly we've been talking a lot about how this is going to be endemic. If I look at this chart, I see kind of that 400 mark is where we kind of don't go below for a very long period. But given the resources that we currently have in our region, where is that kind of, okay, this is a sustainable level, whether it's 400 suspected visits, 200 suspected visits, where can we say, okay, this is where we have the resources to comfortably manage this?
I would say, when we were at that 400 level, that was, we'd moved to orange. Now, we didn't even get down to yellow or green yet, but we did move to orange. And I think with that equilibrium, the healthcare system was, not as certainly stressed as it has been the last several weeks or what we've seen in our peak. So it's definitely manageable, I think, is what we've seen. But the lesson is, we still want it to go lower than that. I think if we continue to just do common sense efforts that can continue to slow down the spread, we can get lower than that. But, certainly before Delta, the levels that we were at were certainly more manageable, but it wasn't nothing.
Okay. Okay, thank you.
Okay. Next slide, please. These are then the admissions, confirmed admissions in the prior 24 hours. And again, so you can see it's turned around and the numbers are going down, but look at the absolute value of those. These are still very high levels in terms of the number of admissions, and these are higher than even the prior peaks that we've seen. So it's good news that it's turning around, but again, not a message that we can just, everything's, perfectly fine, because these are still, putting stress on the healthcare system, absolutely, as well as, the workforce stresses with so many people testing positive. And again, I just relate, I'm sure every one of you is aware of people and hearing of all these people testing positive, even people that have been, pretty cautious throughout this, and it's just so easily spread, this Omicron variant. Next slide, please. And then these are the confirmed inpatient counts, again, turning around, but the absolute levels are as high as we saw in the Delta wave peak. So we still have a ways to go before it gets down there, but to your point, Commissioner Koch, if we can get this down to, under 200, that would certainly be much more manageable, certainly for the healthcare system. Next slide. Then the deaths, you can see some indication, and there is a lag in the deaths, as well as, the hospital numbers lag the case counts. Some indication this starting to go back up. But not to the high levels that we've seen. But again, there's a trailing indicator with this. Next slide. This is from our dashboard, and you can see the average number of new cases, and the 7-day rolling average is declining, now to a little less than 3,000. But then again, think back to the days when we counted 200 cases a day. Sort of hard to remember back, but our scale and our sort of expectations have changed throughout this. But again, we're still almost 3,000 new cases per day on average. Next slide. This is the vaccination data, and from the state, you can see the percentage of the eligible population for Dallas County. That's the 5 and older vaccinated with at least one dose is now about 72%. The percentage of 5+ fully vaccinated, about 61%. And I think when you look at the entire population, it's more like 56% or so. Next slide. And this is the trends in terms of the vaccination numbers. Unfortunately, last couple of weeks, we are seeing a decline in the number of vaccinations per week. I think the latest number that we saw was about 11,000 now of first doses per week. So that's down, we've gotten up to about 15,000 per week a couple of weeks ago. So that is, again, not the direction we want to go with that. So we are continuing certainly to try to get more first doses, and as well as boosters and others. Next slide, please. And this is the breakdown just for Dallas County. Again, 1.78 million vaccinated with at least one dose, and about 1.5 million fully vaccinated, and about over 500,000 that have received the booster dose. Next slide. This shows, again, that it is more, the hospitalizations and deaths are almost dominated, certainly by those that are unvaccinated. With the Omicron variant, have certainly seen that even vaccinated and boosted persons can get infection, but the vaccine is still very effective at preventing severe illness, hospitalizations, and deaths. And so, again, the large majority of people who are hospitalized and the deaths are still among those that are unvaccinated. Next slide.
Doctor, before you proceed, with regards to, since we're talking about Omicron, the presence of stealth in the region, is there any update?
The presence of, I'm sorry, say that again?
Stealth Omicron.
I couldn't understand the presence of.
The stealth Omicron virus.
Oh, stealth Omicron. Yes, so that has been identified in I think 2 or 3 patients from the UT Southwestern. It is still not known in terms of how much more easily spread it is, or if it's more resistant to the vaccine. I think in South Africa, it did quickly take over the original Omicron variant, but still it has not been labeled a variant of concern yet, but it's certainly something that we're all watching very closely to see how that progresses. So, but what we have seen, still the vaccine and the boosters have provided protection against all of the variants thus far in terms of preventing severe illness, hospitalizations, and death. But again, and this chart right here just shows how rapidly the original Omicron variant took over the Delta variant, and this is for Public Health Region 6 for the United States, so that's Arkansas, Louisiana, New Mexico, Oklahoma, and Texas. So again, it is something we're definitely watching closely, but it's still to be determined how significant a role that will play. But again, it's another reminder of why we need to still remain vigilant and just not go crazy and try to just go back to total normal, even though some of the indicators are improving. Again, that's a good thing, but hopefully that is the lesson that we keep learning. We still need to be cautious throughout this. Next slide. Again, have some, we are continuing to monitor for flu. The good news thus far is still that the percent of positive tests overall, it's still under 3%, so that's quite low. We hope that, again, the preventive measures for COVID-19 are also effective against influenza, as well as getting the flu shot. Another message we want to continue to get out there. But so fortunately, knock on wood, that flu will continue to stay low in our community. And then the next slide shows the number of hospitalizations and deaths. And again, those numbers are still low as of the week ending January 15th. Next slide. Next slide. We continue with our community vaccination efforts. And again, thank you all and your staff for all of their efforts to get these community vaccination sites and pop-up sites, working with various partners. And so that's, an important for all of our efforts to reach those that still haven't gotten the vaccine and make sure that access is available. And then the next slide is then the latest list of the testing locations that are out there. As we've seen in the past, the demand for these goes up and goes down, and so we continue to see that. As I mentioned, the vaccination demand is now, first dose is about 11,000 per week. We're certainly seeing some of the decline in the testing demand, and what we've seen before is that does also go along with the declines that we see in new cases. As fewer people are developing symptoms or being exposed, then fewer people going for testing, and we saw that earlier, but we are still, having a lot of testing availability throughout the county. So I think that's all I have. Yes?
I realize that we'll probably be talking about this a little bit later also, but when I look at testing and vaccinations, and still the incredible, I would say the high need to pay attention to both of those parts, in reaching out to communities or neighborhoods that have had lower vaccination rates, are there things that Dallas County is doing to educate, to pass along information, to facilitate maybe transportation? What are some of the things that we can measure to see, okay, what are we doing that's having a positive impact on our larger community's ability to take care of the situation we're in?
Sure. And, we're working with a lot of community partners, and again, with your staff and others. We've been putting out, and I think I mentioned at the last PCCI analysis of the census block areas with the highest unvaccinated numbers were for the youth, because we're really, that's the younger populations are some of the lowest vaccination percentages. So we're doing continue to do a lot of efforts with that. We have the weekly calls with all of our community partners and get this information out to everyone. We're doing, continuing the block walking and all the community outreach before these various community vaccination efforts and testing. I think I sent up some of the update on the media campaign and the different stations and efforts that they're doing, and some of the metrics that they're reporting in terms of reach. So we're trying to refresh some of the messaging with that. We are again continuing, and I know some of the other efforts. I know some of the vaccination providers continuing to work with the school districts on some targeted school efforts. So those all of those efforts are ongoing to try to reach these pockets and areas where there still aren't as high vaccination rates.
Thank you.
And one of the things I want to thank is Lancaster, Dr. John Ellis Price, and Superintendent. We've launched, Dr. Wong, an effort out there at Beverly Humphreys Stadium today. Last week, my staff did primarily for employees, once we disseminated our profile of our policy, I guess I should say. We did some of them at the South Dallas Government Center, and we're doing both testing and vaccination. So all of the sites that we're trying to address now, we're addressing testing and vaccinations. And so I look forward to your staff making sure they generate that information. I didn't see it on yesterday, but we continue to put it out there.
Yeah, and I know I saw some emails this morning. Our PIO is working to try to get those messages out, also to publicize the new sites and everything.
Okay. Thank you, Doctor.
And I just want to thank you, Dr. Huang, your staff, and the great coordination that you have with our offices, and of course with Parkland. I think we have seen some of the changes in the numbers in areas that just a year ago were areas completely untouched. And while we still have some of those areas that are challenging, I think the numbers are starting to turn, and it couldn't happen without your hard work and your team. Thank you, Dr. Huang.
Thank you.
Thank you. Now, if the court will, under the suspension of the rules on M7 for court orders, we've got people here with us today to present. And so if we can cue that presentation up. Here today, with us is Ms. Kimberly Shaw, President of the RBCA, and Mr. Doug Denton, who is the Executive Director of Homeward Bound. At the executive session of the week, staff submitted a plan to the court. The proposal focused on strengthening the rehabilitation model in very targeted areas. The roadblock for those who are formerly incarcerated is not an easy path. Employment, a roof over your head, supportive services, even for those willing, those essentials might not be there. So I'm excited to see the broad partnership that's been formed for this initiative. Together, we're equipping those formerly incarcerated with the training, and again, with the opportunity for a job, with a place to live, and access to appropriate treatment as needed. We're giving individuals a second chance and meaning it. So through this court's direction, we're in a position to make a real public impact and worthwhile utilization on the American Rescue Plan funding. The result of this program reduces recidivism and increases the prospect of building up positive and contributing members of this community. Mrs. Shaw, Mr. Denson, thank you for being here, and would you please update the court on this significant initiative?
Before we move this, we need to move and second it.
Yeah,
Correct?
yeah. Okay, yeah, you're right. Let's move M7. Did I get a motion?
And I second.
Okay, got a motion, second. Any unreadiness? All those in favor?
Well, do we want to hear first and then vote? Do we want to hear about it first?
Well, I wanted, yeah, that's what I was.
Yeah, no, I just
Okay,
wanted to get it on the
just for discussion.
Yeah,
Okay,
yeah.
gotcha. Okay, Ms. Shaw?
Sorry.
They helped me on my Robert's rules this morning. Go ahead.
And you know, before you start, I also want to recognize someone that is in the audience today, which is the president of the Regional Hispanic Contractors Associations, Mr. John Martinez, which is a fundamental part of the Second Chance program. Mr. Martinez, thank you so much for being with us because you're in this presentation. You're in a specific part of this presentation. Thank you.
Ms. Shaw?
Thank you so much, and good morning, honorable commissioners. As Mr. Price said, I am Kimberly Shaw, president of the Regional Black Contractors Association, and I'm joined today with my partners, Dr. Ralph Adams, our program director, and Mr. Doug Denton, with executive director of Homeward Bound. And we are very delighted to present to you the Joseph Lockridge Housing Initiative, a supportive service and workforce development community. And Joseph Edwin Lockridge, was born July 15th, 1932. He was one of the first African Americans to serve in the Texas House of Representatives since Reconstruction, and he represented the 33rd District in Dallas County. Mr. Lockridge was a HBCU grad. He graduated with his undergrad from Southern University and received his Juris Doctorate from Howard University. While in office, Mr. Lockridge, his primary legislative focus was mental health, and his primary legislative accomplishment was creating a law that, or enacting a law that created halfway houses for recovering mental health patients and aiding them in reintegrating back into the community. Mr. Lockridge's life was cut short when he died abruptly in a plane crash coming back from Prairie View College in 1968. Former inmates face numerous, thank you, not yet, just on the project slide, I'm sorry, you can go back. Former inmates face numerous psychological challenges, including isolation, stigma, discrimination, instability, and those have devastating outcomes, such as failed relationships, homelessness, substance misuse, overdose, recidivism, and even suicide. And without the support system and necessary resources to help them reintegrate back into the community, formerly incarcerated individuals experience mental health effects and housing insecurities. Next slide. I'm sorry, this is Ralph's slide. Thank you.
The project objectives is
Reverend, introduce yourself for the record.
Oh, I apologize.
It's all right.
Commissioners, my name is Ralph Adams. I'm with the Regional Black Contractors Association, and thank you again for allowing us to present this information on this morning. Project objectives is outreach, workforce development, affordable housing, and wraparound services. The Regional Black Contractors Association have been an excellent provider in the community when it comes to working with justice-involved individuals. Our workforce initiatives, high-demand occupational training, and job placement assistance has been impeccable. Matter of fact, 3 years ago, we had over 80 individuals working at the Dallas County building providing the rehab services, and these individuals did a wonderful job. But what we discovered in this is that even though individuals were successfully employed, they were sleeping in cars, staying at transitional houses, living in shelters. Yes, successfully employed. And also even staying in trap houses. If you don't know what a trap house is, a house where drugs are being used and drugs are being sold. An environment they did not want to be in, but of course, they couldn't find adequate housing because of the stigma of being justice involved. So with that, there's an evidence-based program that the Regional Black Contractor would like to initiate, and that's to provide individuals who are justice involved, returning citizens, with adequate housing in this workforce community. And of course, we're not naive to know that wraparound services are critical to this. We understand that mental health plays a major role. Substance abuse support, peer recovery support, job coaching from workforce development specialists. These things are adequate for the success of those individuals who could possibly have adequate housing, transition from this housing, and possibly become home owners. And so this is definitely a futuristic program, one of many that could possibly be incorporated here in Dallas County. And I'd like to bring Doug Denton up, the Executive Director of Homeward Bound.
Thank you, Ralph. Judge Jenkins, Commissioners, Doug Denton, Executive Director of Homeward Bound. And the question is, how are we going to pull this off? And the RBCA and Homeward Bound are going to enter into a joint venture to manage this project and manage the property and try and do our best to keep it, as Ralph said, evidence-based and moving forward as we can. We've consulted several attorneys. Jesse Oliver, our board chair, many of you know, has looked at this project, and we think a joint venture between two nonprofits maintains their nonprofit status and is an appropriate vehicle, potentially leading to another creation of another nonprofit that is sustainable in the future. And you know, we've looked at this and think we can have this on the ground by the time the property is acquired, and we'll be meeting with an attorney in the very, very near future to get this corporate structure put together.
You just said you think that the partnership of two nonprofits maintains nonprofit status. Is there some question about that?
Just want to make sure. Don't want anything to, you know, as the IRS starts to staff up, you never know what they're going to think, do, or look at. So always want to be very careful. Make sure the T's are crossed, the I's are dotted, and the period at the end of the sentence.
Next slide.
That's mine too.
Yes.
Okay. As Ralph said, and Kim has said, we're very strongly committed. Homeward Bound is very strongly committed over its 40-year history of supplying services to people who are in danger of going to prison, have been in prison, or in. And what our experience is, anybody that's involved in substance use, has substance use disorder, using substances, has an alcohol problem, are probably out there committing criminal offenses, whether they have been identified by the criminal justice system or not. As I say to my clients, what you're doing right now will get you in a lot more trouble. I love the sign that I see on the highway. A DWI will cost you at least $10,000 and ruin your life, and it will. Anything we can do to interrupt the services, the cycle of addiction and the deterioration of one's life is our mission. And we will bring to this project we will stand ready to bring to this project anything that we can to address the needs of the clients that we're going to be working with. So I hope we can address some of the jail population problems that we're looking at and start to bring them through this project as quickly as possible. Second chance projects throughout the county, you'll see that later in our partner slide. I think we can bring something that we haven't seen in a long time to housing projects.
I'd like to make a comment, question, whatever on this point. And from my experience in areas of addressing needs of people in Dallas County, it's a system. And part of it is with the living room, we were starting to address people becoming educated on what's available to address needs and referral systems to services. And then some of the things obviously going on direct service that you provide, the deflection center, which is trying to connect the criminal justice and mental health issues. And then this, because how often have I heard you say, okay, so we get people in a better place emotionally and psychologically, but where are they going to be? Where are they going to live? Where are they going to stay? And then the other part is what the good gentleman in the back was saying was that, but then you still need that, it's sometimes just minimal support, but support to keep them in housing that they've already got. And so I guess I'm seeing the pieces in Dallas County are now coming together. We probably are missing a few that the three of you standing in front of us could identify. Transportation is still an issue. Any comments or words of wisdom?
Yeah, and we're addressing that. By the way, you got a letter coming that I sent to Ms. Lee regarding those issues.
Thank you.
Both for Redbird, Lone Star, and 52nd. We're addressing those with DART, transportation issues. But one of the things I really want to drive here, and you know, Doug's got over 40 years in this community in terms of supportive service and all, but my colleagues, I want you to understand that there is a program in place that takes individuals, trains those individuals, puts them through a very rigorous training, gets them jobs, and then I think Reverend Adams said it, in no place, all of them don't have, you know, drug issues. All of them don't have mental health issues, and appreciate all the wraparound services. But this is about people who are on jobs, who, again, maybe having to live in a trap house, maybe having to live in a shelter, you know, can't find housing because unfortunately, you know, that stigma and the rule is very few people will rent to them. Once you fill out that application, if none of you have seen that application, once you've been formally incarcerated, King's X. And so nobody wants to take that opportunity. This is about housing for people who have been formally incarcerated and providing them the opportunity to rebuild, you know, their lives.
Excellent. And Doug, how many people do you think you're going to house? I mean, what will be the capacity that you think you will have at the maximum capacity after they get out of jail? How will be the process of getting these formerly incarcerated into this facility?
Mr. Bazan.
You want to go to the next slide? Yeah.
Yeah, next slide.
There you go.
Okay, great question and great segue, Dr. Garcia. So the supportive service community consists of 67 apartment units, keeping with 1 and 2 bedroom options, by the way, and keeping true to our mission. We don't want to displace anyone that is currently in the apartment facility. So we will definitely use those people that are there first. You know, if they have workforce needs, job skills training needs, recovery support needs, any type of wraparound services or case management needs, we will address those first. And then through natural attrition, we will backfill those units with people from the program.
Okay. Well, that leads me to my
What's your occupancy right now? Because that becomes the second question, right? If you're going to take care of the people that are already living there first, and you have 67 apartments, I mean, how many do you have empty right now?
So right now, it's at 95% capacity. And we expect that our program is going to be a year long. So after 1 year, you should be rehabilitated on the job and have some rental history to go into your next place.
So for 1 year, really, you're keeping 95% the occupancy that you have. We're not doing anything with the formerly incarcerated.
We'd like to have 100% capacity.
Yeah, well, that's the
Yes.
goal. But I mean, it's not going to happen in a year. That's what you're saying, right?
No, we have a long waiting list of people
Waiting
who could
list.
use
That
use
could
the property.
But you have 95% occupancy in the apartment complex right now.
Correct. And there are people that are leaving through natural attrition whose leases are going to be ending. Once the property is officially acquired, I'm told that there will be at least 19 units that will be on month-to-month leases.
So 19 units in 1 year.
Yeah, okay, I need to get these numbers right, because okay, so how many total units?
67?
67 total units, and so we're 95% occupancy, so just a couple are open right now, but 19 are coming online here soon. Okay.
How does that happen? What do you mean 19? You mean people are moving out?
Yes, their leases are expiring. Yes.
So when they expire, you expect them to leave?
If they could benefit from the program, we'll definitely assess that and see where they're at, because what I'm told is that some people were receiving the Homeless Alliance assistance, and that has run out for them. And we'll need to talk with them and see, maybe they need a job, and maybe they need some help. And so we'll talk to them and address that. However, we are expecting 19 units to be backfilled if those people are going to new places.
Well, and I think what my colleague was talking about earlier is, well, only 19 units, but then as people move out next year, it'd be about 100 units, right? Or so.
There's only 67 units.
67 units, yeah.
He said 100%, 67 units.
Yes, there's definitely no shortfall of people that we can put into the units.
And you're not going to renew the lease of people who wouldn't fit into your program, right?
No, if they're not a part of the program, no.
So over the next year, because no leases are longer than a year, right, at this place? So the next year, it'll be a 100% program.
The current leases that are in place, we're not going to touch those until they expire.
Right, but they'll expire sometime in the next 12 months, right?
Not all of them, no.
That's not.
Some of them are 2-year leases, or?
Some of them are multiple year, yes.
Okay.
And so over a period of years, yes, we will eventually phase out.
Within the next year, you're really looking at maximum 19. That's exactly it.
Yes, yes.
Okay.
I mean, that's nothing. How many people come out, we have in the ex-offender program, how many people will need these services in Dallas County, based on the numbers that we have?
Well,
How many people a month? Don't we have like 400 people a month live in the jail?
no.
How many?
Well, I mean, you got a lot of people leaving the jail, but that doesn't mean that they're eligible for this program. And that's what I tried to make clear a few minutes ago. First of all,
That's
this is
what I wanna know.
this program, you don't get a chance to just exit the institution and then go into the program. They have a program whereby individuals get trained. Go through, Dallas College, they train it, they got a very regimented program. Then once they do that, Reverend Adams and Ms. Shaw and all of them, they take and then they go and reach those tentacles and place those individuals in jobs.
And makes sense. How many people are we looking at?
Well, I mean, and this is not the only unit. I know they've been doing some others. So, I mean, how do you know from how many people just graduate?
Yeah, we graduate about 15 to 20 every 4 weeks
Okay.
from the training program.
And typically, how many of those can find housing?
Ralph, you have a
But that's-
stat? Yeah, it's, I definitely say 70% of those need housing assistance.
Okay, well,
May I ask a couple, or do you still?
And when we say 67 units on the property and 19 available, understand they're double occupancy. There'll be two people in each unit, each of the single bedroom units.
Okay.
So just start doubling the numbers. So
Well,
if
that's
there's
30
19
people.
available units, that's 38. As we have attrition and move up toward the 60, 67 apartments, you know, those numbers will approach to 100, 120 people over the course of the next year plus.
In addition to what Doug just interjected, is that we also have incorporated an exit strategy for those who have leases that are getting ready to expire.
Okay.
Because we've partnered with other entities that would transition them into other housing facilities in Dallas County.
Okay.
So we're not going to leave anyone hanging. We just want to make sure that those there understand there's a workforce environment.
Thank
with
you.
support
Could you please
services.
wear your
I'm
mask?
sorry. That will allow them to be self-sufficient, but more importantly, transition into home ownership if that's something that they want to.
Commissioner?
All right, so let me just kind of frame this a little bit for the record and for the public. So, you know, the issue that we're talking about is the invisible prison, right? You know, the idea that, you know, many folks, either when getting out of prison or even getting out of jail, even for a short stint, have lost access and opportunities to get jobs and certainly have a hard time finding housing for all those reasons. So there's the man-in-the-box type movement regarding jobs, something similar with housing. And this moves us in a very specific direction, though, because I want to make sure it's clear for the record that we are only contemplating individuals that have a job. They have a job in hand, so they have the income, they absolutely can sustain the rent. Now they need the things to keep the good train rolling, right? So you answered the questions regarding the current occupancy. The entity basically needs to be ready in 45 days. I mean, we were talking about that IRS potential problem. Like if we approve this today, and we're going to be, you know, our purchase agreement, you know, we're going to close on this in 45 days, but we're going to have whatever, I mean, you know, if the two entities need to somehow, you know, do something in transition, right? I mean, this needs to be ready in 45 days. Is that going to be the case? I mean, we got to have your word on that piece.
That should not be a problem. Attorney assures us that a joint venture is especially of this nature, is a easy thing for, at least it's easy for her to put together and bring us together, set up the joint ownership and get it on the ground very quickly, get it registered, get a bank account open. The two entities can join together, get a bank account open and get it started and assume management with no problem.
But I don't want the court to miss, and anyone in the presentation, this model, even with what we're doing, will cash flow. It's not as though we're going to, you know, we're hanging out.
How much?
The NOI is currently estimated at $384,511.
Yeah, I'm not so much worried about that. I just want to make sure that we have an operator taking it over right away
No.
to handle that piece.
No,
And then-
I got it, but I didn't want anyone to think that, golly, we hear 19 and then we have 38 doubling and then it's like, wow, we're not gonna be able to make these numbers work. It's cash flowing.
Yeah, the numbers are going to work, yeah. I have no problem with that.
Mr. Wilson, the county will retain the ownership of the property.
Yes, we would, your HFC would hold the property. And regarding the occupancy number, a lot of that was formed around just the optics and sensitivity to displacing anybody currently there. So
I understand.
I want to revisit that, though, just because of this particular mission. This is going to be very male, right? And largely overweighted with individuals with drug offenses, right? I mean, in all likelihood, what we're looking at, so how is it, particularly regarding wraparound services? Because wraparound services always get, you know, a little bit tricky when you have monoculture, when you kind of have the same amount of folks. And you know, sometimes, you know, bad habits and bad things are easily more spread and sometimes stronger than what you're trying to do positive for those individuals. And other times, with the right culture, you end up reinforcing the right things to get out of that trajectory. Has there been any discussion about maintaining a certain occupancy level of those not in the program? So I know you have all 67 there, but I mean, does it make sense to leave behind a quarter of the, units for other individuals to rent? So, these individuals are seeing families walk by, and there's just, it's not such a male-dominated culture in one place, in one very close confined area. I mean, what kind of, thinking regarding the culture of the place has been done in that regard?
Well, the beauty of using a solid base of peer persons in recovery themselves and persons who experience this workforce development program, the work coaches, is that those folks will be on the ground and creating community inside this system. And as we start to meet, and I think as Kim said earlier, some of the current residents were placed there by Metro Dallas Homeless Alliance and subsidized their rent in the height of COVID activity. Those folks may well need our services. I think Ralph said that some of those folks may need jobs when their subsidies end, maybe work ready, at least work trainable. And some of them may have problems they want to come forward with and let us start to address. So it's about creating community on the property and not leaving anybody out. One of the first persons I met when I was touring the property was a Vietnam vet about my age. And he recognized my age and immediately saluted me and then shook my hand and said, "You've been around a while, haven't you?" And I said, "Yes, sir, you have too."
And I think that's one of the comments I would like to make too, is that I feel much more comfortable with this project because I see the years of experience that the partners bring. Because we have to put together a good workable package. And if you've got entities with your track record, I feel a lot more comfortable that we'll be able to handle the challenges. And we know there's going to be challenges with the, as already been noted, with the specific type of individuals who are going to be there. But you've been around this block before. All of you have. And I think that's what gives me a lot more comfort on how you put together the management package of this. So I mean,
and this program replicates,
possible.
Our original program with Dallas County Courts, the Seidler House program that Mrs. Clore and I created back in 1980, in which that was the whole point, address the disabilities, get people out and working, pay their fees and fines, and get on with the rest of their life.
Yeah.
And this is the point. And if there's anything I know how to do in working with these partners, it's to put that in place.
And the timeline says, it's not as though they haven't given this, as Doug said. Some of it been around here long enough that, we've seen this model before. The difference is, in this area, I think it's appropriate. I don't think we have to, worry about whether or not gentrification is going to take over anytime soon, and that's been one of the challenges. A stable community, and I recognize that the property, as I said, it's a good use.
Commissioner Koch, I like your 45-day projection, as I think we've learned with the Deflection Center and a few other projects. Things can take a little longer than we expect. There's already a property manager and a maintenance person on the property. It'll be a seamless transition into the management and care of the property.
when you said the 45-day and you were feeling comfortable with that, I was thinking recent experience would give you a little bit of pause on whether or not it's doable. But then again, you gotta set your mark and
all of you are welcome
strive towards it. And then, if the environment throws a few curves, then you manage.
And you're all welcome to come down and take a look at the Deflection Center anytime and gauge the process of that little project. So things take time, but I think we're going to be very ready.
In the meantime, Mr. Rosan, I would like to know, I want to support this item because the county has control of the property. I want to support this program because it's in an inception, a good program because of you, Doug, because of the leadership of the Black contractors, but I would like to know, and I want that information to be sent to everybody in the court, how much money we are investing in all the different programs per capita per person. How much is costing us? For example, we put $1 million in St. Joseph, and we have 13 units there. You know,
St. Joseph's,
the money
senior
that we
housing.
put in the different operations that we're doing for
I
mental
understand.
health and housing, you know, I would like an analysis of how much are we doing and how many people we're helping and the cost per individual in different projects.
Yeah.
That's it.
I'm very much in the same place in that regard. I mean, this absolutely scratches a necessary itch, and, you know, for me to justify it to my constituents would be, hey, listen, we're taking what is a relatively small amount off the tax rolls and adding a benefit that's absolutely tremendous, because when you look at, you know, the lifetime of earnings of an individual, the taxes they'll pay, and just the good life they'll live, this is a worthwhile investment in that regard. But it all comes down to management. I mean, we own the property. We're not managing it. We're not the ones that are the guiding hand of keeping those individuals, you know, on that good train rolling. And you know, that's just kind of where my, not nervousness is. I mean, got to see it happen. This model is not drastically different than the other things we've done. But, you know, certainly want to keep a close eye on it for a host of reasons. One, just the accountability piece, but then also how and if we can replicate it, not only in this particular, because clearly you have folks that are going to be in the waiting list. If you're graduating folks every 15 of them every 4 weeks, well, you know, that's going to be a heck of a waiting list. You know, taking and really doing a good job of studying what things are successful, what's not successful, because there's other areas, you know, whether it be, you know, other areas of substance abuse, or there's other pockets of folks that are somewhere similar, right? I mean, they absolutely have either, you know, have a job, and there's other things that need to be sorted out, at most importantly, housing. So this is certainly an area where the county can and should intervene if we have that good model, and we can say to taxpayers, hey, listen, you know, not only are we, you know, saving lives, if you will, but we're doing it in such a way that, you know, we're in the black, right? I mean, we're absolutely doing more for our community than was taken off the books tax roll wise. So I just want the data every day, all day.
Yeah, but this is not their first rodeo.
Absolutely.
Yeah, they've been, no. They have been doing this. This is the collaborative opportunity to make Dallas County, and that's part of the partners. They have projects like this right now in the community.
Well, and that's why I think what Commissioner Koch is saying, and what I'm trying to put on the record as well, is we need to start following not only how successful the investment that Dallas County does in different operations. I mean, second chance, transitional, mental, I mean, seniors. You know, how successful and what is the cost per. So we know what is a plan, we know what is a program that we could put money in the future that has a record of, of achievement. And then, Doug, I mean, it's going to be very instrumental to follow up some of these people, and I will be more than happy to help with the Criminal Justice Advisory Board to decrease recidivism. I mean, as we're starting to put money on all the different aspects of mental health, incarceration, transitional housing, gentrification, you call it however you want. You know, the county is now starting to invest in different areas, in different models, in different communities. Now, my idea as a commissioner is I want to be sure that when I go out to the community, we know, this is successful because we have helped so many individuals not to go back to jail. We have helped so many families, to get back their kids, to get their families, their lives together, go back to work. And then, addiction, what comes with mental health, etc. All the pieces together and see how much our money as county commissioners, as constituents, as taxpayers goes in every single model.
Dr. Garcia, Commissioner Koch, you'll have within 30 days a management and lease agreement too. Within that document, we'll have the accountability mechanisms in place. There's monthly reporting that shows you the attributes of each person in there, whether it's voucher funding, how it's funded too. So we'll bring that information back to you within 30 days. And I think the questions on accountability will be answered.
And also, Mr. Bazan, don't forget, as we always do, be sure that the legal document that the county does not manage per se any of these properties.
We're working closely with our attorneys
Thank
on
you,
that
Mr.
matter.
Representative.
Well, we keep saying in manage, we didn't manage that dadgum COVID hotel out there either, and I told you within, 2 weeks, 3 weeks, we spent $900,000, or whatever it was. We didn't manage that, but we always have the opportunity of oversight to make sure it is performing. I mean, we don't just do this stuff
No, we are involved. There is no doubt about that.
Yeah.
we don't do this to just walk away.
No. And the only differentiate I would draw there, right?
The only difference what?
The only differentiate I would draw with the COVID hotels, right? You're dealing with a crisis. It's just a little bit of a different animal in that regard that, regarding the variability in cost, it's not going to matter, 7-8 months hence because, we're out of the woods in that regard with having a lot of folks pile in there. You know what I mean? This, for it to be sustainable, right? I mean, and this kind of goes to one question. We have to make sure that there is an escape velocity. That same, we're here for a year and then we're moving on to our own housing. If there's a logjam there, we've got them a job, we got them good housing, and now, your lease is up and there's no opportunity to move on to the next piece of housing, what then? And that's certainly something that, we're going to see the data as it works over the course of that first year. But that is going to be the, one of the make or break points. How are we doing this, and do we need to get better at it? Are we, because we're still working on the model, do we renew a lease for a year? Or, we're going to have to stay hard and fast to nope, it's a year to put pressure on the individual and maybe the outside support groups to get them into that next piece of housing. I'm really interested to hear your thoughts on that, because that could be a point where, we've done great for a year and now we have a real problem because we have 20 individuals and one of them can find housing somewhere else.
But what I'm saying is not too dissimilar than what they're doing now. How long have y'all been renovating and putting people in housing?
Yeah, well, the RBCA, since 2014, when Chairman Proctor took over, we immediately have been doing this and doing it with personal finances and begging and donations and lots of prayer. And we've been very successful in doing that. And going back to personal investments, there have been people that have bought their own properties and their own houses and have reached out to us because they also believe in this. And so we've developed a network of resources and referrals that we can tap into. But to your point, Dr. Garcia, there is a lot more work that the county could do for people like this because it is a growing problem.
What is that success rate? So, you guys have, how many folks total have you had in the program over the past year, and how many folks have been able to transition out to housing either they purchase or they're signing a lease?
Our 2021 report, I'll be sure to get that to you. We're still compiling data, but we do have a 90% placement rate for jobs, and that is offering...
For job, you said?
For job placement.
Okay, housing. What about the housing piece after a year in housing?
We haven't been able to house anyone officially, so we've been referring to partners, if that's what you mean, but yeah.
Okay, so you've been doing
But your activities have led to permanent housing.
Yeah.
Correct. Well,
And that's what you're
yes.
continually doing and have for years.
Correct, and we also see a desperate need for more and for us to be more
Yeah, we're
involved
working
in the
on it. We're
control
working on it.
owner-operator seat, so, yeah.
Well, I think this is a good start. It's going to be interesting to see, how it works, what are going to be the big issues. I think Doug Dingman has the experience to do this, so I just want to be sure that the Commissioner's Court has the big picture as we continue to do this kind of programs. Thank you so much.
You're welcome. I wanted to, before we sit down, I do wanted to recognize our collaborative partner who is here, the Regional Hispanic Contractors Association, who provides skills training, lots of skills training for our program participants, and we'll be working closely with them as well as other employer partners, Lone Star Justice Alliance. We have a workforce development program, First Step Community Empowerment, and several other community referrals that we're going to be leaning into. So thank you again for your support.
Okay, we got a motion and a second in regards to M7.
Any further discussion? Hearing none, all those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously.
Thank you. And now that, if you want to go to your resolution,
Yeah, let me knock that out real fast.
Okay.
That's a big hole right there.
All right, next before us is a resolution for Employee of the Month, for the month of January and February. If there are any employees of the month here, feel free to come forward, but with COVID, I think everyone is still at their desk. So, whereas for the last 10 years, Dallas County has recognized outstanding employees through our Employee Recognition Program. Each month, select employees are formally recognized by the Commissioners Court at a designated session where their names are written in the record of Dallas County. And whereas the third annual program allows elected officials and department directors to publicly salute employees who rise to the challenge of public service and represent the first-class public sector organization we strive to be. And whereas the employees recognized today have been chosen for their hard work and dedication to meeting the demands of their individual positions and the overall strategic plan set each year by the Commissioners Court. And whereas for those who interact with Dallas County, our employees represent who we are as a public entity. The efforts by the employees listed below ensure that the public sees Dallas County at its best. These recognized employees perform above expectation and ensure that Dallas County continues to be a regional leader and the destination of choice for residents and businesses. The Dallas County Employee Recognition Programs sets each of them apart as a model employee worthy of this honor. Now therefore be it resolved that the Dallas County Commissioners Court does hereby salute these employees for being selected as Employee of the Month. Kimberly Rawls, Criminal Justice. LaShonda Jefferson, Criminal Justice. Raisha Crossland, District Clerk. Preston Johnson, District Clerk. Jacqueline Leach, Pretrial Services. Stephanie Johnson, Pretrial Services. Juanita Aguirre, Tax Office. Yadira Zamaripa, Tax Office. And we offer best wishes for continued success in Dallas County, and I so move.
Second.
All those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously.
You can't do it without them.
I just want to take a moment of personal privilege to welcome two future exemplary employees. Joining my office is Shannon Rust and Jenna Byers, and they're here in the court today, and looking forward to it, and unfortunately not looking forward to losing dear Peggy Lundy and Chris Davis, who are both heading out on retirement, and if I say anything more, I'll probably get either tripped or punched in the face because I was told not to make a show of things. So, God bless you.
Welcome, and Peggy, you're going to be missed. Thank you so much for your years of service to Dallas County.
Safe travels, Peggy. And welcome to new folks.
Yeah, and you are another one that escaped and came back, but,
That's right.
But okay.
Didn't you?
yeah, I know. I didn't want to leave. I just want to make sure you were coming back.
The difference, Ms. London, is he never wants to escape. He likes the torture.
Yeah,
Thank you for your service, and Chris, wherever you are, thank you for your.
yeah, thank you.
Our goodbyes to Chris.
Thank you. Judge, the next I want to go to, because the judicial performance at Frank Crowley Courts, it's a continuation, and then I'll come back because we got the agenda suspended. Anyway, Dr. Wong has already presented, I'm sorry. So, okay. The court should have the presentation that we continued basically from last week. A number of the questions that were asked, we took and paired those questions in a way that we could talk about. Part one is the 2019 to 21 disposition by the county courts and all that was presented on January 25th. This part two is disposition by the courts that were filed and assigned during that same time period. And you'll see, really what makes a difference. Of course, I arrive at the same conclusion with regards to performance and work product. You will have, the first one is the average days between assigned and the file date in of course, all 3 years, 2019, 2020, 2021. And what you'll see is cases assigned, then filed, when the defendant was booked into the jail and assigned to the court before, and that's the operative word, before the case was filed with the DA. And so when you look at the courts and you see the number of cases that each one of them had, and basically most of them are, in and around, 1,000 cases. It shows from the time that case was assigned to the court before the case was filed with the DA, they're all averaging almost 2 months. They're averaging 50 some odd days. The other part of that is the cases, and this is 2019, filed and then assigned. Now, the defendant never booked into Lockridge jail, and the DA accepted the cases, and then the case was assigned to the court. When you look at those particular cases, look at the difference. These individuals, the number of cases, again, all pretty much in the same range, give or take a few, and then the number of days it takes for that case that, again, was filed, and then the case was assigned to a court. What I think you're finding is, and then we've in the next page we'll probably get even better, the average day between cases that were signed and filed. One of the concerns, again, we continue to have is that, the system in a lot of ways is not speaking, to itself. They're not communicating. We continue to give coordinators, we continue to provide all the tools, but at the end of the day, if in fact nobody is really managing that system, then what we have is a system that's just basically out there. Now, what you're going to find is on that whole assignment, and a lot of this hovers around, and you're going to see Senate Bill 6 in your package, and I'm still, for the love of Mike, I cannot figure out why we in Dallas County are not following that model that Bexar County has done. First of all, Senate Bill, I want everybody to be cognizant. I hear a lot of reliance on what is done, what it's not, hasn't done. Remember, Senate Bill 6 just went into effect in January. So what were we doing before that? What are we doing before that? And all Senate Bill 6 says is that if a person is out on an offense and commits another, is on a bond, and commits another offense, then that individual cannot be magistrated by the magistrate, must go to the what we call the home court, to the judge, to the presiding judge. Now, we hear from some of the judges that, well, the reason it has to return to us is because we've got all the data, we've got all the facts regarding that. Well, if you've ever seen any of these portals, what the magistrate does is reduces his or her notes during the magistration period and basically transposes that information up to AIS. So they have all the information, whether it's the the presiding judge there or the magistrate. They have all the information present. And why our group of judges will not allow the magistrate who has access to all the information at the time, rather than zeroing out the bonds, is really not unexplainable. When you go to this area where it says average days between file and indictment dates, now we're just dealing with average days between assigned and file dates. You come back to the average days between the file date and the indictment date. And what it says here, and you've got your model in terms of what shows is dismissals, pleas of not guilty, pleas of not guilty by the jury and sentenced by the jury, non-adjudication of the guilty, which is just an agreed plea.
Commissioner?
Yes.
They need to advance.
I'm
so
sorry.
the public can take it. No, I just don't want anyone to lose
There we
the
go.
facts.
Okay, I'm sorry.
Quickly on that last point, though,
Sure.
if you can help me out with that, because I think that's an underlooked point, and I think the public really needs to understand that piece, is that, other counties, other places are efficiently using their magistrates. These are individuals, these magistrates are hired by the collective district court judges.
That's correct.
So to say that, somehow I, as an elected judge, I got to keep everything, kind of hoard it, if you will, right? Why are you not using the resource that's just there, that you approved regarding that hire, in order to move the wheels of justice? And you know what? It's not unusual in our court system. We have a problem with the permanency court. There's 3 family court judges that will not use that. And there are children in the CPS backlog that could be freed up by Judge Gonzalez, right? So it's not uncommon. I mean, judges kind of hoard these things. And, question for you, what do you think the public should be doing, or what do you think we should do to break that logjam? Because right now this is injustice, right?
Exactly. Well, and that's what we're basically, I'm bringing it to the public and to, my colleague attention, that what has happened is other jurisdictions have made this seamless and move forward. Again, I hear these excuses with Senate Bill 6, but again, that just went into effect in January, okay? So our magistrates, basically, were there before that. So now why all of a sudden, we don't want to give, or they don't want to give, that jurisdiction to the magistrate to be able to move forward. That magistrate has all of the information from law enforcement, has everything right then at the time of magistration. And so that is what is key to help the system continue to be moving. Now, in the lawsuit, I understood, I'm not going to say anything other than the fact that there was supposed to be some apprehension at that particular time. Bexar County moved forward. They didn't have any problem. And so, I think that's what we've got to say to our judges, what's the problem? You chose these magistrates. We don't get a chance to. You chose them. You said they were qualified. And so, are they capable or are they not?
And another question in that regard, I think this is right, that those magistrates, they do little else, really. I mean, truly, they handle the pieces of booking and stuff, but the biggest thing they do is this bond hearings. They should be considered expert on reading the data, on making sure, and as so long as, we can look at those decisions they've made in the past and say we haven't had these wild outcomes where someone was given either an entirely too low of a bond and goes out and commits a crime, or someone was, assigned an exorbitantly large bond and kept. Now, those are instances that can be corrected by the court, but I don't think I've heard a complaint by the judges that their magistrates aren't doing a good job during the normal course and that they're not expert in doing that job.
Well, if this court will recall, what we're basically saying, we had Plan A on the books. During the lawsuit and all, Plan A was rebuffed by the judges, primarily because what this court and staff had proposed is under Plan A, that for the limited purposes of magistration, that we would appoint the public defender's office, would be able to have a hearing, and then whatever happens to the case, indicted or so, then those judges appoint whoever they want to, but for the limited purposes of magistration. That's what Plan A was and was supposed to move. And of course, we were rebuffed during the during the lawsuit. You know, that is a plan that was well thought out and gone forward, and but for that rebuffing, that's what we are. The average days between the file date and the indictment date. Now, see, this is where we're starting to getting really hammered. All total, we got cases up there that are sometimes almost 2 years old.
And Commissioner, don't you think that, we should have some of the judiciary and the magistrates come and give this presentation? What are they doing about these numbers? And what are they going to do in the future so we can manage, we can change, we can do? Because here, we can analyze what's going wrong all day long, but unless it's the people that actually have to deal with it every day, come and tell us what are they doing and how we can help them. I mean, we're not changing anything around here.
Well, but we're getting the information. What we want to understand is, first of all, we've given you the tools. We're analyzing the data. We invited them.
Well, and I think we have. I mean, I've been quoted publicly. I think we have done as much as we can to help. But obviously, it's not working. So I would like to have them come in here and tell me what are the issues that bring us this data that is not, in our opinion, not working. Because, I think that unless we have them here and they explain to us why these numbers are the way they are, we're not going to move anything forward.
Fair enough. Yeah.
Well, and that's as well. You can invite, but you can't force.
I understand,
Okay.
and we hope that, they have elected leadership among themselves,
You
and
know what? We can subpoena them. We have that power. So,
and they can either.
Well, let's try to avoid that.
But that's,
just saying.
we will hope it will be voluntary, but, I really believe that it's time that someone, and we have plenty of judges there, that can come, like Maricela Moore have done it, have some of the judges
Well,
in
but
the
that,
past
that's
have
on the
done it.
civil side. We're not talking to the
No,
civil.
but Commissioner,
Judge Huff knew this presentation was going forward. We said we've met with them, we've done the walkthrough, we've augmented the.
have we asked someone personally to come and do this presentation? Who?
Yes, Judge Huff. I just told you she's the presiding judge.
Well, we are going to ask the judge to hopefully come, in 2 weeks and give us a presentation. He knows where we're going. He knows what we want to know. And if he doesn't want to do it, hopefully he can ask one of his colleagues or her colleagues to come and do it.
Well, she's the presiding judge. Mr. Heichel did not outreach, and did she know that this was on, and we talked about it?
Yeah, but let's say that she doesn't want to do it, or, just bring us someone that, with a presentation, I would like to see a slide presentation, if possible, that will integrate all the different parts that we have been discussing here in the last two courts.
With the lawsuits, there's some concerns that they've expressed. Pending Dave's lawsuit, there's some concerns they have about coming here and saying things publicly.
Okay.
So that's part of the concerns, Dr. Garcia.
Well,
they were invited.
if that's part of the concern, doesn't have to be publicly. Just send us the presentation, we can discuss it. We obviously, can do that. But, what I would like to know is what are they planning to do based on what we have been discussing, Mr. Heichel, very simple.
Yes, ma'am.
But
we also can meet with them individually, right?
Well, it'd be up to them and their lawyers.
no,
because,
no, you can't.
Yeah, but you had the walkthrough, right?
Well, we did a walkthrough with the collective as all,
Right.
but, you
Yeah.
know, but.
I was in isolation, I couldn't join you, otherwise I would have been there
Well,
too.
no, yeah, I understand. And-
Well, I think that, rather than keep
Disadvantage.
discussing this, let's
Not
see
having been
what we can do, Mr. Michael. Thank you.
Well, I don't know about, like I said, it's nothing that will move. A lot of things like, like the real data. And it's taken, and I want to thank IT and all for the amount of energy they're getting the data, because, they didn't have the data. And we will assume, I'm going to continue to say, one of the problems with all of this is that we still don't have individuals who are showing up, working, and performing. Passing cases does not get it. Passing the case does not get it. They're not working. They're not organized over there. You talk about, we commandeered the cafeteria. We commandeered A5. We did all of this for jury services. And you think, are we moving forward? How many jury trials are we having? So, my thing is that we just got to continue to bring light to it. They could respond, but there's no, apparently no, deal to, want to respond. So, okay, so the court has the data. You see what each judge is doing. I mean, other than that, we have no jurisdiction. All we can do is either provide them with the tools to move forward or continue to elevate in the court of public opinion who's working and who's not working. And I think this tells us exactly, who's not working. And I'm going to still say, when I got people who continue to pass cases without the district attorney, just do what they want to do, then, all we can do is continue to say there's a problem.
Who compiled this information?
Between IT, criminal justice, they're pulling it out. LaShonda was pulling it out
Of the mainframe?
Yeah, pulling it out of the mainframe.
Okay, thank you.
I think it's helpful to kind of just take a look at two numbers. If you go to 11 and see the cases that were disposed, right? Right there on that bottom corner, 20,244. And then in the next year, you're looking at 13,827.
There's our 10,000.
That's a drop off of 32%. 32% less cases were not disposed of. And they don't just, walk away. Or they're sitting in jail, or they're hanging in limbo. They're out on bond. That hangover, if you will, is going to be a major challenge in 2022, 2023, 2024, because it's not like the train stops, right? There's more coming in every day, and older cases get priority because of speedy trial motions, and the wheels of justice are going to be broken down real quick.
And Commissioner, that's one of the reasons in modeling this so-called backlog court. We went through all of this with the judges, the DA, the sheriff. We went through all of this modeling, because one of the things we were concerned about, you can bring in all these visiting judges and they can, quote, hear the backlog case. So still, what are you doing? What are you doing? Those cases are already filed. One of the things Judge Creuzot said, he said, you expect me to take a case and ramp up a new DA in a backlog court when in fact they've been with that case all this time? Same way with a public defender. So it's not that easy, other than you take new cases and plug that into the backlog court. Those other cases, that's what this represents. This represents cases that are already in the queue. Yeah, these cases have DAs assigned. These cases have either public defenders or appointed lawyers assigned. They're already there.
Well, and I think there's another point close to that. You look at this, we're talking about, 32%, close to a third, right, hangover there, right? We assigned one court. We created one backlog court. right? A third of those cases, if we were to divide them between the 17 that are on those district benches, right? It's a little under 6. It's a little under 6 courts that would be normally taking care of that 32%. We have one court doing it. So the idea that that magically wipes away this hangover, no. I mean, there's still basically the work of another 5 courts that has to be done on top of, you know, what we've already provisioned. This is crisis type stuff, and for folks not to be paying attention and not really be, you know, getting something done right now, and this is only going to get worse.
Okay, I just wanted the court to, again, continue to be apprised of the fact, and, you know, and I know a lot of people, you know, don't want to say that, and I'm not lumping everyone in the same category, but most of them are not working and are not performing. And these numbers, we didn't make these numbers, they came out of the mainframe. These are the numbers that are there, they're broken down by disciplines with regards to the court, and, you know, there's our almost 10,000 cases that's in a arrearage. I still say, you know, we didn't have money, you know, just to burn, because we're not going to get any real churn out of that $3 million for a backlog court when the cases that are there are still there and just spinning. The judge, so it seems not to be an appetite. We published the numbers for 2 weeks. So, I mean, and so there's nothing else, you know, we can do. People feel as though they're still cuffed by the lawsuit. Well, particularly by that. I know the TRO went away, but, you know, there are some other things they're looking at. And one of the things is this. So we're trying to get information, and I will get you another piece to see, since Senate Bill 6 in January went into play, what's been the impact. Judge, with regards to the month, you know, I definitely don't want to, you know, disappoint y'all. This is the first day of Black History Month. You know, I just find the hypocrisy in this country to be amazing. When Ronald Reagan appointed Sandra Day O'Connor, said, I'm going to appoint a woman. When Joe Biden said he was going to appoint a black woman, all of a sudden, oh my gosh, despicable, abomination, affirmative action, Ted Cruz, all of a sudden, but nobody said anything when Reagan wanted Sandra Day O'Connor. So, you know, as a black man, I understand it. Hell, I live with it every day. There's a piece from the LSE Business Review that presented an article last year that Parkland executives should consider a must-read, even though they talk about a teachable moment, and they found a black woman lawyer to do a teachable moment. If I can say so myself, Parkland, this presents a teachable moment. There are 50 things you should never say to black people, and here are just a few. Can I touch your hair? Or they lunge in to touch it without asking. You speak so articulately. You know what? You don't sound black at all. Can we just use your, initials? You know what? I didn't do any of that. I'm sorry for my ancestors. As though you're not the beneficiary of your ancestor. These are just a few. I don't see color. Then you're blind. You're without sight. These are just a few. But it goes without saying that you will never single out your black employees and give them monkey mugs. Anyone above a supervisor level should know that. And we can continue, Joe.
All right, next up is our consent agenda. Is there a desire to pull sheriff's personnel from that, Dr. Garcia?
Nope.
Oh, great, okay.
Move the consent agenda.
Second.
Okay, Dr. Garcia, second, I'm not sure who got that. All those in favor, signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Next, we have the bids. Is there a motion on the bids?
There's only one bid, Judge, and I would move that bid.
Yes, it's a sole source purchase,
Right.
I mean, for doors that we have to replace. So, yes, I second.
All those in favor, signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Next, we have the RFPs. Is there a motion on the RFP?
I'll move the RFPs.
Second.
I did ask Mr. Frosch and did get a breakdown on RFP 1 with regard from 2017 until now. 2017, we were doing about $500,000, $530,000. Today, we're doing about $1.4 million. Chris has told us that with regards to, I guess, District 1 and the service center, we get a little better break, but they tell me the difference between that utilization, we're at about $1.4 million now. We get very little break off of retail as it comes to, gasoline. But we're going back out in the marketplace. And of course, we talked this morning about the challenges of us putting in our own deal, and as we're trying to go more hybrid, it doesn't, make sense. But I still say 2017 to now, $1.4 million. We've almost tripled what we're spending gasoline. We haven't added any more miles in Dallas County, and I don't know if Chris is keeping that kind of information, but let's say they double the price of gas since 17.
Well, it has.
Huh?
It already has.
Yeah, that's what I said. Well, that's fine. That's fine. But we almost tripled $1.4 million. $1.4 million. And so, that's on the fuel card side. That has nothing to do with what we're spending.
But then the question also becomes, is that the standard? Are we being treated any differently? I don't think so.
Well, I don't, Chris,
Mr. Frost,
you and
is
Mr. Frost.
is that true?
Well, what are you thinking about? All I know is when I looked at the RFP, I went and asked information, and then I looked at it for each year. And, we've been in, other than, maybe it was something special about that year, 2017, we just only did $500,000. But everything else has been $1 million, $1.1 million, $1.3 million, $1.4 million.
But you're talking about the market and economic environment. Is that true, Mr. Frosch?
Christopher is.
And I just want to bring to the horseshoe that this is about the fleet fuel car management software, not about the amount of money, but with that, if Mr. Roden thinks it's okay.
Yeah, but it's the same thing. I mean, it ain't like they're gonna, buy candy.
No, I know. I just want to be sure that we're not discussing something that is not.
I've already checked.
Yeah, Commissioners, I'd have to go back and look at 2017 and see exactly, what drove the increase. I do know that we did bring on a new service center at that time, DeSoto, so our capacity did increase in terms of the number of fuel tanks that we have out there, storage tanks. So that might be one of the indicators, but the price of fuel has crept up significantly over that time. But I can assure you we track and monitor usage, idling, and we try and encourage our folks to use our in-house facilities as much as possible.
Okay, and is that any different Dallas County compared to other counties, or Dallas County compared with private industry? So is it all, they're economic, and it's an economic environment that is pushing the cost.
I think
Yes,
there's a geographic.
I would say so.
There's a geographic part to this too. You only have 2 fuel sites for Dallas County, and one is located at RB1, and then the other is, far south at the Automotive Service Center too. We've explored actually bringing in additional sites, and I know Mr. Hooper researched that. It's expensive. We looked at across from Frank Crowley as an option too, where you have CNG if there was a way to get a county station there too. But then you have the flip side of that is we're trying to go more green and pursue more electric vehicles. And I know we have a lot of different pilot projects that Mr. Hooper and Mr. Frosch are bringing forward too. So we're weighing in more gas, gas tank capacity.
And I know, and
versus
he explained all of that, and that's fine. I want somebody to know that somebody is at least watching the cost with regards to this. And, as I
we
said.
do, and it's constant encouragement to the Sheriff's Department, the primary driver of those costs too. So Mr. Hooper, and I've worked with him, work with the chiefs, encourage their team to go to ASC and fuel when they can. But a lot of times, there might be a lot of good reasons that they don't drive in that direction, or maybe that their gas tank isn't empty in in a location where there's a county service tank.
Well, I know freeway management, most of it's supposedly, and Chief, you here, is on, and it on 20, Chief, yeah, you're here. And most of your freeway management, I know you're servicing, the courtesy patrols and all, but in most of your freeway management, 80% of it on 20?
Yes, sir. Most of it is on the southern half of Dallas County from I-30 south, and we do utilize ASC as much as possible.
Okay, but again, when I look and I've asked purchasing to break it down with where these stores, where these stations are, we're utilizing it. See, if they are the majority and they're running freeway management and they're running south,
we need more green vehicles.
Well, they don't make police.
And thank you, Mr. Hooper, but
They don't make, we're not driving Teslas.
It's coming to us, and it's coming faster than we ever thought.
And when they get here, I'll take a Harley Davidson truck as a police car. My point is, until we get there, I'm keeping watching this creep, and that's all I'm saying.
It's going to happen just because of the nature of the growth that we have incurred too.
Well,
but I do have a question related to the item that we're approving. Is the car management software the same one, Mr. Frosch? Is it changing? Is it going to create another need for training, et cetera, et cetera? What kind of software are we putting in this RFP?
Yes, ma'am. The item is to have a fuel system and a software system. So ultimately, at the end of the day, they're going to issue cards, manage the cards for us, and provide the analytics necessary, like you're just mentioning, to make sure we know where the spend is, so we have the reports necessary. So it's basically a complete system. They issue the cards based on the demands of Dallas County with parameters set by Dallas County, and they provide the analytics and the software on the back end. So they're basically providing all of the management of the system. We don't want to be in the card issuance business, and they restrict actually the spend on those cards, as we know. So you can't walk into a service center and buy anything other than gas. So that's a card management program that's used by a lot of large fleets across the country. There's a few people that do this really well, and we just want to go out and see if we can get the best deal.
Sounds good. Well, I like that, Mr. Rosen, and that should help Mr. Hooper and facilities to track even better where we're spending the money in gas. Thank you.
Okay.
And was it moved? Second?
Yeah, I believe you discussed.
Okay.
Yeah, it's moving second,
Yeah, it's moving second.
Judge, you can call the question.
Favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. Next, this takes us to our court orders. We have court orders M1 through 18 and addendums 19 through 29, pulling 26 and 29 for separate votes. Are there any other pulls?
Yes. Commissioner Price had 3, 13, 19 for separate vote as well.
Yeah, and I pulled 13 back in, Commissioner. The 3, I pulled 3, and then I think it was 19. Hold on.
What happened to 23?
Yeah, I pulled 3 and 19.
I think
Pull them for
23
2
was-
weeks or for separate discussion?
That's probably separate discussion. I'm gonna
Okay,
read
separate
it to the-
discussion, 3 and 19.
Yes,
13 went back.
13 went back.
Okay, I have pulled 26, but Commissioner Koch already pulled it, so I move approval for the agenda items from A to 18, addendum 19 to 29, pulling 3, 19, 26, and 29 for separate discussion and vote.
Is there a second?
Second.
A second by Commissioner Price. All right, any discussion of these court orders?
I just have some comments of the ones that are here. You know, I am glad to see the authorization for the National Regional Hispanic Contractors Associations Training and Safety Foundation Second Chance Program, which we have discussed early this morning. I am also very happy to see about the planning and development changes. While this is, you know, only for 2 years, I want, you know, give kudos to the department for trying to think out of the box. The changes in retail, the priority areas, and of course, the living wage that is required by the new changes. I like it. Thank you so much, Mr. Tamayo, and to your team. I am happy to see these changes, and I guess we will be brief, you know, how we are doing with these changes in the next 2 years. And that is pretty much, we're going to discuss, the decontamination of showers and restrooms, Mr. Bazan. I know that this has come in the Facilities Committee. When was the last time that we did this? And, I mean, isn't this a contract that we usually do?
In the past, there has been services for enhanced cleaning, whether it be COVID focus or electrostatic spraying or other measures too. So there's been different companies utilized for that. Here, this vendor is specializing in the particular service of decontamination.
Of mold?
Yes, for abatement and remediation.
Okay. I just wanted to be sure that it was nothing that we miss and it's something that it has to be done regularly, or?
You have a committee meeting coming up too, and maybe we could highlight this and give you a full update there.
Sounds good. Yeah, I want to be sure that we're doing everything before jail inspection comes and be sure that we're ahead of that ball.
Absolutely.
Okay, sounds good. And I think those are my comments, Judge, colleagues. Thank you very much.
I would like to make a comment too about in purchasing, we've spent a lot of time over recent years trying to make the process as fair and leveling the playing field as much as we can. And sad to say that we are in types of businesses sometimes that do not lend to any flexibility in either getting product or a particular service. And case in point is the 4 items involved in purchasing that in looking at competitive bids for it, there would be no change because there was only one entity that either offered the commodity or offered the service. And so that even though the heart, the will of this court is to open up as much as possible purchasing to include smaller entities, thus expanding on making how we do business look like Dallas County, sometimes just the realities of our world make it so that we cannot do exactly what we would like to do. And so just, want to commend Mr. Frosch and always keeping on top of that, because it is the will of this court to pay attention and to continue to study and continue to make sure that we're doing what we can do in those areas of making work done in Dallas County look like Dallas County.
And if I may, Commissioners, we agree that sometimes you have sole source, like the doors we have here that were installed originally, that we have to go back to that manufacturer because of the operational aspects. The pest control is a nominal amount, but we agree that if we have a local vendor that can do that going forward, we want to compete in those areas. We do have 2 RFPs that are going out that will be evaluated by the SBA team. to make sure that we have an opportunity for inclusion in those areas. So we do recognize that's very important to the court, and we will continue to strive to work with Jesse Crawford and his team to do so.
I did have a quick question about court order number 1, though, and it's about the stack court. And apparently the grant was not received to pay for it, so Dallas County is essentially picking up that cost. The intent, though, is for an application to be made for that grant in the future. Is that true?
Yes.
Who's doing stack court?
Yeah, because no one has been able, Commissioner, to collect the data. So that's why this is a temporary one.
Well, I understand that, but we still need an administrator and data collection on it.
That's
And I
what it is.
understand that's why we're picking it up, but what does that mean for next year?
Dr. Watkins, are you in the call?
Yes.
Okay, thank you.
Akita Dickerson and her group has been trying to assist the judge, and so they reached out to us to say if they could get some assistance during the interim period so that they'll get the metrics needed to apply for the grant, which is coming up within the next month.
So the plan is to apply for the grant again and hopefully get it for the next year coming up.
Yes, ma'am.
Thank you.
Otherwise, we're not getting it back. You can call the question.
I think you called the question, right?
All those in favor signify by saying aye.
Aye.
Any opposed? Motion carries unanimously. All right, now that brings us to number 3. So motion on 3.
My problem with number 3 is that,
We're gonna move it a second first. You wanna move it?
I move approval.
Okay,
I second for discussion purposes.
go ahead.
yeah, you know, I know the court has not had the benefit of my concerns with regards, and we're talking about double filling this position. You know, there are about 10 vacancies out there now.
Mm-hmm.
And, damn, I mean, am I missing something? I've been around here, as I said, for a few years, and I've never seen this many vacancies. And we're less than 30 days out of an election. We're less than 2 weeks out of early voting. And double filling this position, I just can't bring myself. We just keep throwing it, but I mean, I just don't think we're there. I mean, and I didn't try to pull it. I guess you could say emergency, but double filling. Damn, when you go get the training? I just don't understand. And some of the things that, you know, and I guess I can't speak to them because I've been generating them in email. I just got a real problem with it. So, you know, I just can't support it. And it's just that we just keep throwing money at it. That's not going to solve the problem. And like I said, you know, I thank God I'm not on the ballot, but it's just, we got, you know, Houston, we got a problem. So.
And Commissioner Price, I share your anxiety about this, but we need this position filled exactly because we have so many vacancies, exactly because we're 2 weeks before the election, and exactly because we want to be as ready as we can to challenge this next election.
And this double fill, this is someone who's burning off time. This is not someone who's in the office, right?
Right.
Okay. Yeah. I mean, so basically, we don't do this and then someone's not sitting in that spot, right?
Yeah, they won't.
Right, so I, for that reason, I gotta support it.
Okay.
All those in favor signify by saying aye.
Aye.
Any opposed?
Nay.
All right, motion carries 4-1. Next is 19.
19, I just want to, you know, read into the record. I said I pulled it the last time, and it's really supposed to be pulled for 2 weeks, but I'm going to let it go. Okay, so if somebody wants to move it, it's supposed to be pulled for 2 weeks. Okay, but that's okay. That's all right. We'll move forward. I recognize, I just want you to know on the record, I recognize that. But anyway, somebody want to move it?
So moved.
And,
Second.
okay. And I wanted to read into the record, I did meet with Ms. Mentor, and, and I thanked her for taking time to meet with me. And as I said, I hope she gleaned that I was sincere regarding inclusion and diversity. I asked her about reviewing the press Gainer reports regarding Parkland. And while there's been some, mediocre improvement in nursing, I told her she could bring the voice and courage of those career professionals that have been marginalized. She talked about her diversity and inclusion, was her hallmark, everything from Odessa, where she was a charge nurse and had 10 individuals, to Kuwait, to UT Southwestern. I think what she said she had as many as 40, again, the charge nurse. But like I told her, she's going to have opportunity to perform on another stage. And I talked about Prairie View A&M, land-grant institution with a premier nursing program. One of the problems I continue to hear from the Black Nurses Association is that Parkland has not, in terms of their recruitment, been very aggressive in reaching out to Prairie View A&M, again, which has a premier nursing program. And that's one way for them to demonstrate that they are genuine and can prove it. So I appreciate her willingness to serve, but it means nothing if she failed to represent the core of hospital nurses with diversion and inclusion.
I would just like to make the comment too that Ms. Minner has a very long history of doing precisely that, and that she will bring a voice that has been noted to be missing from the Parkland board, which is with half of their staff being nursing staff. And now we have got a person who has been that particular type of nurse all of her career, and that she has stepped up to represent staff internally, but then also through organizations and in the community. So she does have a strong history for recognizing the role and the position that nursing has in health delivery systems. So I am, in talking with her also, feel confident that she has always been part of that voice, and will continue to be that voice on the Parkland board. So I'm looking forward to what she does bring.
In Odessa, she had one black. In Kuwait, of course, she had none. And at UT Southwestern, she had 3. I queried, we spent time talking, because I clearly asked her. It's interesting what we want to call diversity. Again, I said that about no problem that we've got, all these women on the Supreme Court, but the first time somebody said something about a black woman, all of a sudden, again, it's despicable, it's abominable, and it's affirmative action. Really? But, you got nursing programs that are premier, and Parkland, other than doing that monkey mug thing, they not down there recruiting. And I'm getting this complaint from the Black Nurses Association. But yet and still, we turn a blind eye as though everything's okay. Call the question.
Well, and I just want to add that, we wish in an ideal world, every single minority that is in Dallas County will be represented everywhere. Commissioner, I do hear what you're saying. I represent 45% of the population, and we're not represented in a lot of places. And I completely agree with your statements about, discrimination, about lack of diversity, and that we need to include more people. But the only way it's going to happen is by telling them what we expect from them. And I think Ms. Minis understands that. She speaks several languages, and she's been a nurse for most of her life. So while I hear your concerns, I also like to think that there's hope and optimism in the future, and I just hope that her leadership and knowledge, translates into the Parkland board, and I'm going to support her. And thank you, Commissioner Dallas. She's replacing a Latino that did a great job, Mr. Jesse Vallejo, in bringing issues from the nursing staff to the board. And I think, and I hope she will do a great job.
Well, this court will remember that I complained probably more than anyone in this court regarding these same concerns, and finally, within the last year, Karen Watts is no longer there. Finally, after being, chosen over an African-American woman who was a PhD in nursing. And all of a sudden, according to Parkland, she did not fit the culture. Again, some more of those exclusions. I just find it peculiar. And again, I'm going to continue to raise the issue. You can feel confident. I don't care how many languages you speak. Hell, if you just speak English. Black folks can't get through the eye of the needle. We cannot get through. It's not as though anybody's pointed them to programs where they could recruit. They still can't get through. And so when you hear, going to point to first black woman, Sotomayor was appointed by a black man, but still with no black woman appointed. But all of a sudden, a black woman is said to be appointed, and then all of a sudden, we got all these adjectives. Call the question.
Any further comments? All those in favor, signify by saying aye.
Aye.
Opposed?
All abstain.
All right, one abstention. Motion carries 4-0 with one abstention. Next is number 26. Is there a motion on 26? And I know we have some amendments, I believe, for 26. So does somebody want to read that into the record? Well, they need to know what the amendments are to know whether they want to move it. So.
I move for discussion.
Okay, who has the amendments?
I'll second. Second for discussion.
Come on up, Charles. Is that you have?
Thank you, judges, commissioners. I haven't been given any amendments other than potentially an amendment on the buy for the radio stations. And so staff on the radio buys. And so staff is happy to make that amendment should it be the will of the commissioners court. I believe the suggestion has been to lower it down to 25, or from 25,000 down to 20,000.
Okay, so the amendment I was talking about is Dr. Garcia brought forth a concern that there are voters out there who do not speak English, only speak Spanish. So, and I had asked yesterday to staff as I was going back to winter weather, what's that universe and how do we reach them? Okay, and so was that done?
Yes, yes, that was done. The roster of radio stations does include 2 Spanish radio stations. There was an error on staff's part not to include Spanish outreach, the language of Spanish outreach, as part of the documents that we provided to the Commissioners Court. It is always expected of our...
But the new census, okay. If you want to go down that road, new census says we've hit the 5% Asian mark.
Vietnamese, but...
Vietnamese, Asian.
No,
and we can add them.
It's Vietnamese is the language. But the thing that we should look at, and I want to be fair to everyone out there who wants to absentee vote, is what is our universe? For instance, if we have 10,000, I believe our entire, if I'm correct, and I may be off on this, but I think I saw in one of the documents from elections that they thought that the absentee mail ballot universe was 15 to 25,000 people. So my question is, of those 15 to 25,000, how many of those folks speak only Vietnamese? How many speak only Spanish? And let's make sure that we communicate these changes of needing, you know, it's better to have your last four social and your driver's license. Here's how you do it. Track your ballot. All of those sorts of things. I'm not sure if the best way to do that is to put Vietnamese advertisements or any advertisements on the radio, but that's why I would leave it up to the marketing company. You know, if we only have 100 people, we really could do some personalized calls to those 100 people. But at any rate, it sounds like you already had Spanish in there. It just wasn't in the documents that we got.
It is always assumed going forward, and has been in the past, we just neglected to put it into the documents presented to you today. That Spanish outreach is included as part of all of our marketing outreach, unless we specifically target only an English audience, like you saw last
actually said
Commissioner's
that.
Court.
There was I thought in a place it said that, but
Yeah,
great.
and
So
that's on
not a
staff.
problem. If you want to go back and look at this Vietnamese question, what's the universe, what's the best way to communicate with them? We can do that.
Yeah, so I think going forward, the best thing for us to do is just to make an amendment to the executed portion of the court order, the language in the court order, saying that English, Spanish, and other languages as necessary. That gives us the flexibility, staff flexibility to give the marketing consultant direction on how we'd like to proceed, and that is all based on data that we get back from elections on what they think the universe looks like that we're targeting.
And that is
That's a request
and
for an
I
amendment.
think, Judge, that covers what you say and what I asked.
And so do you accept that amendment?
Yes, definitely.
Who
I mean,
seconded this?
we have. I mean, in the
Second.
future, you know, like you just say, Mr. Reed, every single marketing has to outreach to the community that we're trying to do. You know, I mean, just like Commissioner Price, how he feels when people say, you know, she's not qualified and they question the qualifications. Same way I feel when someone knows other languages that are very important in this community.
So, if you can address this, because this is kind of where I'm having a little hard time with this. I mean, can we get this done well in advance of February 18th? Because, you know, that's when people have to get these ballots in, right? So we have a time crunch. And then also the dollar amounts in here. I mean, if we're talking about here in the briefing, it says we're going to get this universe about 15,000. Even if we push it up to 20,000, spending $74,000 on this, I mean that's $3.70 per person. Why the hell are we not calling these people for less than $1 a pop? I mean this is pretty expensive per person. I mean this is not efficient in any manner. So I mean this is pretty sloppy.
So part of this marketing and outreach proposal actually includes the community engagement phone calls that you're talking about. It also includes the radio spots, which can be turned around fairly quickly within days of approval, and then the typical Facebook ads that we normally run, that we've run for other initiatives as well. And so most of this can be turned around really quickly. It's been referenced that the amount is a nominal amount, and that's because of the short time frame that we have to turn this around and how short the advertising period actually is.
It's a nominal amount for the entirety of our budget, but you spend $7,000 on a hamburger, we have a problem, right? I mean,
Understood.
and this is wildly disproportionate. Not only that, we're talking about 100% of the universe. If you get 50%, return rate on this, then you're looking at $7 per, right? Per that came in. So I mean, this is really inefficient.
And
Hear you. Happy to provide the metrics.
And I would agree with you, Commissioner Koch, that it is inefficient. It's brought about by SB1 and the confusion that it's caused, and then so it requires
That's fair. That's fair. But how long have we known about SB1, right? I mean, this is sloppy.
As far as knowing about, the ballot tracking thing not working, as far as knowing about 40% of the early ballots and now 11% are being rejected.
That's
and
fair.
remember that I suspect, we won't know until we open the ballots, but given that the majority each year of early absentee mail-in ballots are Republicans.
Yeah, oh, yeah.
I
no,
suspect that the people that are being disenfranchised right now are members of your party.
That was the next thing I was going to say, that this disproportionately, hurts my interest in that regard, but it hurts taxpayers' interest when we're kind of being blithe about 74 grand.
But we've spent an enormous amount of money on countywide voting and all sorts of initiatives to make sure that the votes counted, and these elderly and disabled people deserve their best chance. And I know we all want to give them that, to have their vote counted. There are things, unfortunately, that become emergent that are expensive. This is really it's not expensive in the grand scheme of things, it's nominal. But, the weather that's coming up on Wednesday, I guarantee you, we will be spending an inordinate amount of money somewhere because of that weather to help only a few people. But that's just the way these things work.
And then kind of the next piece of that, though, is that we're talking about this initiative for the primary. We're not talking about the general election, the ultimate issue of who you're going to, get into office. So I also have a little bit of a problem here is why aren't we hearing from the Democrat Party and why aren't we hearing from the Republican Party on how they're going to fill this gap? I mean, this is, yes, it's our problem, but it's also a number of other people's problems regarding, the running of their primary. We're a contractor.
They'll have 6 months, though, to tell their prospective voters, hey, make sure to fill in the last 4-year social and make sure to track it on this website, make sure to do these things. But for now, even though I understand what you're saying, it's not going to matter at all, Democrat versus Republican. But these people, some of whom are in their 80s, some of whom are disabled, some of whom are in the military, they deserve to have their voice heard as much as anyone else. So.
Do you feel confident the vendors are going to be able to meet this very tight time frame?
We've asked ABI to turn around marketing proposals pretty quickly in the past, and they've been fairly successful at that. So I don't have any concerns on their ability to turn this around for us.
And then comply with the language and geographic dispersion and
Yes,
et cetera, et cetera.
I'm confident that they can turn that around as well. Yes.
And I'm just going to say, Mr. Reed, thank you to you and administration, because obviously this was put together in a very short period of time. I do have to agree with my colleagues, on the fact that we hope that the next round we are more prepared, more in advance. This was a bad proposal all the way around that, cut a lot of the very important population, which is our seniors. I don't know how engaged they're going to be in social media. So I believe that radio and some of the different outlets that you mentioned will be a better way to do it. I also think and agree with the judge that while this seems like a lot of money, the reality is being so late in the game and trying to reach the population we're trying to reach. I don't know that is enough. And then next time, I just hope that we have more opportunity to look at the target areas, to look at which are the areas that we really want to target when we're talking about the senior population that vote by mail. And that's it. Thank you so much. I want to support it.
All right. Any further comments? Hearing none, all those in favor, signify by saying aye.
Aye.
Any opposed?
I abstain.
Okay, that passes 4-0 with one abstention. Next is number 29. Is there a motion on 29?
So move, 29.
All right, this is PPE. Is there somebody pulled this? So
Yeah,
is there
I pulled it. I just wanted to kind of get the history on this piece because this is not coming from purchasing. So I'd like, if I can get either someone from elections or budget to explain what's going on here and where are our old shields. We have had shields in the prior election, so what's going on?
Who doesn't answer that for us? Charles?
This is Scarpella's online.
Oh, okay. Hi, Mike.
Hey, good morning. It's a great question, Commissioner Koch. Initially, we had two groups of shields. One was really well designed, and one was a second group. So half of them were well designed and received in time, and we've been using those. The other half are very large and poorly designed in that they do not, they're very low to the ground, if you will, and that we cannot use them very well with our electronic poll books. In addition to that, because they're so large, they're very difficult to ship. So they're shipped separately from our ESCs, our election supply cards. And that caused a lot of problems with our shipping company and our costs with them. So, of course, we all wished COVID had gone away, and of course it hasn't, and so it's still with us. And so going into this election, we talked to our vendor to try to get more of those better designed ones, because the ones that were shipped separately, the poorly designed ones, are breaking because they are shipped separately in separate boxes. They don't work that well, et cetera. So when we talked to our vendor, the vendor said they no longer make them. So we did talk to a different vendor, and they very quickly designed one for us and are providing that. And I think we found some funds, some CARE Act funds to pay for them.
Okay. And are we doing
So this is simply resupplying our existing fleet.
Okay, and to that, why are we resupplying? I just want to go through the steps of, why that's important. So our individual, do we have essentially redundant protection here regarding spacing? Because are our judges spaced out sufficiently, or we're going to have someone in front of them, right? And this is going to be.
That's correct.
Okay.
Yes, and so this provides our clerks, which keep in mind that our clerks that operate the electronic poll books that interact with the public. A lot of our clerks are elderly, and they're very nervous about the COVID. And so we want to provide them with the protection that they need. And we want to do it in a fashion that is also, the shield is usable. And because those poorly designed ones, many times they weren't even put up because they were not very user-friendly to work in conjunction with the electronic poll book.
So we're protecting the poll workers. That makes good sense. And because they're going to have someone that's close by, passing them driver's license, them passing them their info. But in looking at this, these freestanding sneeze guards are 2 feet high. So if we have a table that's 3 feet high, we're looking at a barrier that's 5 foot, and there's going to be plenty of people that are 5 foot and above, and their mouths are going to kind of be over that. So did we get the wrong size here, or what? What's going on with that piece?
That's actually part of the new design. So they are 2 feet high so that they can fit into our election supply carts, but they also sit a foot off of the ground, off of the table. So they actually stand 3 feet high. And so that was part of the new redesign. And so that they will provide that coverage for someone standing in front and looking down at someone who's sitting down working at that station.
Okay, that's important. Okay, very good. Thanks.
All right, all those in favor, signify by saying aye.
Aye.
Any opposed? Motion.
I abstain.
Motion carries 4-0 with 1 abstention. And this takes us to our registered speakers. Will the bailiff please read the rules of decorum for our registered speakers?
All Commissioner Court attendees are hereby advised that this meeting is conducted in accordance with the provisions of Dallas County Code Section 74-71. Visitors and registered speakers are to preserve order and decorum at all times. Personal, profane, or slanderous remarks are not appropriate and will not be allowed at any time during this public meeting. Any and all applause is to be kept brief in observance of time constraints. Disruptive visitors and or registered speakers may be removed and are subject to the penalties provided in the State of Texas Penal Code, Sections 38.13, 42.01, and 42.05. Registered individual speakers are limited to a maximum of 3 minutes, and the maximum discussion on any one topic is limited to 30 minutes. Thank you.
All right. Our first public speaker is Mr. Loris Phillips. Dolores Phillips. Dolores Phillips. Do you see Dolores on there anywhere? Okay.
Hello?
There you go. I hear you, Dolores. Say something else.
This is Dolores Phillips.
Yeah, I
You
got
do
you.
have
Oh.
my address.
Yeah.
You also have handouts. I wanted to know, could you see the presentation that I sent on screen, or do you have to activate the share screen?
I don't know, man. I don't know, Dolores. Sorry.
Okay, Honorable Jenkins, on last month I asked you, could you investigate what happened to my exhibits and the yellow envelope that was clearly marked as exhibits? It was sealed. It's been missing for like 3 months now. You said that you were going to let me know if you had jurisdiction. This is case DC 2106299. I do not believe it has anything to do with the court. I believe it's bigger than the court. In DC 14069005, when I filed a civil complaint against the city of Dallas et al., they intercepted Honorable Craig Smith's court orders for a pretrial hearing and also mediation. I filed for notice of removal not knowing that Honorable Craig Smith had rendered those orders. It went to federal court as 314 CV 2864. Honorable Tolliver remanded it back to Honorable Craig Smith, 191st, because he said a plaintiff did not have the right to do a notice of removal. That when it went back to 191st Court, Honorable Hasday, Lisa Hasday, of I think U.S. Assistant Attorney, she did a second notice of removal of 314 CV 3131. I continue to be battled by the city of Dallas and Dallas County municipalities and all these endless resources, clout, prestige, and wealth, which equates to power. I'm not a vexatious filer. Ms. Sheila Squire investigated employment complaint back in 2006. She said she believed me. She come back 15 years later, 2021, and said that at that time she was being discriminated herself. So does that warrant you to reinvestigate those complaints filed at EEOC that she believed were true violations but were not signed off on? I'm asking you, Honorable Jenkins, can you please find my exhibits, because I have answers, objections, and responses due to all these. Dallas County alone filed an exhibit of over almost 600 pages that I, as a pro se, uneducated litigant, has to go through, which I say will validate that it's an ongoing conspiracy, open quid pro quo, and that the joint and several liabilities will be proved by collaboration of those exhibits alone. I'm asking you, can you please assist in due justice, and that no pro se litigant should be denied due process because they don't understand the law? Can you please assist me in locating who stole exhibits from a county court? FBI filed.
I'm sorry, you're out of time. Someone from the office will contact you, though. Thank you. All right, our next speaker is Professor Kempton Green. Professor Kempton Green. Professor Kempton Green. Do we see, no, we see him on there anywhere? Okay. Last one is G. Jackson. G. Jackson. G. Jackson. See him anywhere, or her? All right. This concludes our public speakers. We'll now adjourn to our closed session to consider matters under Chapter 551 of the Government Code as previously posted. Any action necessary from the closed session will take place in a subsequent open session. We'll begin closed session here in 3 or 4 minutes. Now, if you're not a part of the closed session, since we're having it here in this room, please leave at this time. Thank you so much.
It seemed like his whole resume was Atlanta and Emory and.
Yeah, and I thought that he could be a little bit more into HR. We'll see. I don't want Commissioner Press to be even more upset
No, you can't, I can't get more
today.
upset. Parkland,
I just try to keep my coolness.
Parkland just sends me over there. They just do shit.
Ready? Ready? All right. No action necessary as per the closed session. Court stands adjourned.
Southern behavioral health.
Yeah, I mean, you see a lot of transplants from Northeast, California, from somebody up in the West, but it's so rare to see Florida, Georgia.
You mean with,
Oh, yeah. Yeah, corporate relocations, I mean, you know, Home Depot and the rest of it. I mean, when it comes to getting talent, I mean, it's so frequent.
Concerns,
Yeah.
kind of where we are on these.